Should we use insects in medicine? You know, I remember not too long ago we were learning about leeches for osteoarthritis of the knee, you know, to take away the pain.
The other thing that they use is bee stings for it, which works pretty good too. You can buy your bees and they'll send them in the mail, and they work. They work. It's a good treatment. It's just that nobody's doing it because it sounds so awful. So we got maggots, leeches, and bees.
No, now we just found out about the maggots. That's what I was going to report. This new study came out showing that maggots are good for infections, especially the infections that people that have diabetes have.
Yeah, it's the ulcers that they're treating. They might be infected, they might not.
So they found out that the maggots debride the wounds just as well as surgery.
Right.
And, you know, the idea of having a maggot eating on me, I think would just like...
Well, would you rather have the injections and the anesthesia and the painkillers?
Well, I think if they use the maggots, I think I just wouldn't want anybody to tell me. I wouldn't want to look at my medical records.
That's right. That's one time you wouldn't want to request them. That's for sure. Well, you know, we have to be creative in medicine. And if you find something like that works, go for it. I mean, it's very unappealing to think about it, no question. But if you can clean up a wound and make it look better than you do with a scalpel, which you do after the first week of treatment. They looked at 100 patients, and 50 of them in this particular study in Archives of Dermatology in December of 2011. They found that the ones that were treated with maggots after a week had a much better looking wound than the ones that had surgical debridement. But at the end of 2 weeks, it was the same. So the authors concluded, well, we don't need to use the maggots, and we'll just use the surgical procedure. But now you're talking about injections, and you're talking about surgery and anesthesia. So the risk would be lower using the maggots, in my opinion, than it would be if we used the drugs in surgery.
Well, you know, this reminds me of something I saw on TV a couple of years ago about people that were going to get pedicures. And I don't know what country it was, but they went and had it in some other countries, so they were trying it here. But they used fish, some kind of fish that eat the dead skin on your feet.
Oh, yeah.
And so the gals were going, oh, it tickles, and oh, you could see the fish that were chewing at the dry skin on their feet. And when they got done, they had these really soft feeling feet. You know, it's like, I don't know. I don't think I'd like fish chewing on my toes.
Well, the maggots work. It's something that can be used, and a lot of the people who did the study thought that maybe this would be something that could be used if you're going to be doing a surgical procedure within just a week after you did after you got it clean. Then there would be a small advantage, and they're approved by the FDA. It's amazing that these insects are approved by the FDA as a treatment for this. But there are other things that we can do for wounds besides that aren't in this article.
The photon stimulator.
Well, that's really right. That's something to get excited about, because this healing light does a lot of things to make wounds heal quite a bit faster. I had a person come to me from L.A. who was in an auto accident and had third-degree burns all over her leg and her foot. And it was going to take grafting and surgery and antibiotics probably for 6 months to get this thing to look right. And she called up and said, do you think the photon stimulator will work? And I said, come up for 2 weeks and we'll see what it does. Well, at the end of the 2-week period, actually after 12 days, these wounds were healed. There was no sign of infection. All the granulation was done. And today, which is a few years later, you can't even tell she had a problem down there. So there are approaches that are novel that we should be looking at. They're really kind of neat. And when you look at the other possibility, using DMSO, you know, you have a burn on you, for example, and an ulcer there. I know myself because I had a burn and an ulcer. And within about 15 minutes, put DMSO on it. Within 30 seconds, the pain was gone and never came back. And it's one of the things that I really enjoy when people come in with burns that are fresh, especially, is to put a few drops of DMSO on it and watch the look on their faces. They go, but it doesn't hurt anymore. And it heals quite well that way as well. So we have to keep our minds open. There are lots of approaches. Some of them are a little gruesome. So we can do maggots, and we can do leeches, and we can do all kinds of things,
bees,
and bees to try and make things better. But I think we're going to be seeing a lot on photon stimulation. And if you want to learn more about it, go to infrared light therapy, put it in the search box, and up will come all this information on photonic stimulation, which will surprise you. And just a little aside here, we're involved with a $6 million grant from the National Institutes of Health now, doing research using this infrared light on people who have chemotherapy-induced neuropathy. So this is not just some funny little thing that I'm coming up with. There's some data behind it. So maggots, maybe. Infrared light, yes.